So hypertensive retinopathy can happen if the blood pressure is more than 140 or even between 120 to 140, stage 1, stage 2 hypertension as well. Do we know?
Hypertensive retinopathy can happen even in normal tension.
Huh.
So for that particular patient, that pressure is high
For the eye.
for the eye.
Ah.
And at this point, I want to segue into also explaining hypertension, that is blood pressure, and glaucoma, which is eye pressure.
Ah.
Everybody's confused about this
Okay,
topic.
please,
It is a
please.
very big topic. The blood pressure, if high, need not be that eye pressure is high as well.
Hmm.
The eye pressure can be normal.
Hmm.
When the blood pressure is normal, the eye pressure could be high. They are two different diseases having two different pathways.
Hmm.
Hypertensive, I'll avoid talking about it, but let's take glaucoma.
Hmm.
Eye pressure,
Hmm.
whenever it's high, what's happening? There are two main reasons why glaucoma sets in. One is too much production of aqueous, too much production of fluid inside the eye. So your balloon, eye is basically a balloon. It's distending beyond its need. Okay. Second is obstruction to the drainage. So it's not draining enough fluid out. There's inflow and there's outflow. Either of these two only is happening.
More inflow, less outflow.
Or correct inflow, less outflow.
Less outflow.
Whichever way, the balloon is distended.
Distended.
When the balloon is distending, it presses upon the retina.
Hmm.
The retina is the extension of the brain, nerve cell, press.
So the brain doesn't like it.
No,
The
brain
nerves.
doesn't. This nerve, if it presses, 1 day, 2 day, no problem. 6 months, 1 year out, the nerve starts to die. I can't take this anymore. One by one, those trillion neurons starts coming down. Those trillion neurons, they start dying. They start dying from the periphery and then come to the center. That's why you start losing the peripheral vision first, and then you lose the central vision. Eventually, you'll be left with tubular vision. So you can only see me. You can't see around me. Right now, if I extend a slap to you, you'll see my hand coming and you can protect.
Correct.
Or when I'm walking down steps, I can see the steps even if I'm looking straight, because I know there are steps. So what happens in the signs and symptoms of those glaucoma in advanced stages, not even early stages, nothing. In advanced stage, they'll start tripping over
While you're walking down the
footsteps.
stairs. So tripping down the stairs.
They'll not be able to see a rod on the side, so they bump their head on the rod because they're only seeing straight. They're not able to see, or they'll not be able to play a sport which needs peripheral vision.